Now to a follow-up on a News 10 NBC investigation into the rocky rollout of a new statewide system for paid caregivers.
When I'm with the Department of Health, I'm literally sobbing. I'm like, I can't take it anymore. I can't.
Those who care for loved ones on Medicaid were promised health insurance, but actually getting that coverage has been an uphill battle. The state hired a company called PPL to run what's known as the CDPAP program. But as investigative reporter Jennifer Lukey reports, the transition has not been smooth.
Lisa Robinson is the full-time caregiver for her adult daughter, Hannah. She's paid an hourly rate through the CDPAP program. A company called PPL now manages eligibility, hours, and payment for all caregivers.
So in February, we started onboarding with PPL.
They ran into some of the same issues we've reported on, like the PPL site and app crashing, delayed paychecks, and spotty customer service.
I have to say that it feels like a really bad choice for the state to force this change.
But nonetheless, it was done. The only thing appealing to the Robinsons was that PPL promised insurance to full-time caregivers. And since Scott was recently laid off from his job, they signed up. So
we were promised May 1, but it was actually June 1. So we signed up in June 1. We get no cards, we get no information. It's the middle of the month. Doctors are asking us, what's your insurance? Because we canceled Cobra. So finally I called and they said, oh, well, just pop on the Anthem site and download your cards.
They did that and gave the information to their providers. It wasn't long before those providers started calling to cancel appointments.
They couldn't get an authorization because they couldn't reach anybody, or that when they called the numbers that they were supposed to call, basically they were told we didn't have insurance.
The Robinsons tried calling themselves.
Then we started trying to get prior authorizations, and all these numbers are baloney. I get cards from Leading Edge. I get cards with Omni on them, but you call them and they say, we're not the administrator.
In her desperation, she called the helpline that the State Department of Health has set up specifically to deal with PPL issues.
When I'm with the Department of Health, I'm literally sobbing. I'm like, I can't take it anymore. I can't. Between, having a child with a complex medical condition that through no fault of her own, and then
all this stress, you can understand the frustration.
All of these startup issues, if they've already done all these other states, why is this so bad?
That is the exact question I asked Governor Kathy Hochul back in April.
Seems like PPL had some issues like this in other states during the rollout. Why did you choose them, and were you aware of those issues, and are you worried that history might be repeating itself?
I was not involved in the selection process. I want to be very clear on that. That's not something I thought was appropriate, so it was done independently, evaluating other applicants and their records in other states, and we feel very confident.
The Robinsons do not share that confidence. A spokeswoman for PPL says she can't get into the specifics, but her team is working with its benefits broker and third-party administrator to address the Robinsons' issues. And overall, she says, quote, we continually look to enhance health benefits as we gain a better understanding of the healthcare needs of the CDPAP population, as well as changes within the healthcare industry overall.
Now, the state health department sent me a statement about a half an hour ago that does not answer a single question that I actually posed to them about whether their hotline is seeing an increase in complaints from people who have similar issues with the insurance program specifically.
Jen, there's also concern about how good these insurance plans will ultimately be.
Yeah, we're fighting for a plan here that they're not even sure is going to be great. A nonprofit website that we sometimes partner with, New York Focus, reviewed lawsuits against Leading Edge, which show it has a history of backing out of paying for things that are supposed to be covered under their plans. So, of course, this is something we're going to keep a very close eye on and continue to follow.
It has been anything but smooth.
Yeah.
All right. Jen, thanks.